Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to dive into the topic of topical finasteride. There's been a recent study published in October 2021 titled Efficacy and Safety of Topical Finasteride Spray Solution for Male Androgenic Alopecia, a phase 3 randomized controlled clinical trial. And it actually looks pretty promising, especially for those who are reluctant to take oral finasteride due to implications of potential adverse side effects. I myself have been taking oral finasteride for like the past 5 years now. Thankfully, I have not experienced any adverse side effects. And the thing is that most people taking it are not going to experience any. If you look at most of the available studies on finasteride, side effects are generally mild, and it only affects less than 3 to 5% of users. And even for those people who do experience adverse side effects, most people are able to reverse it upon cessation of the medication. Now, I will say that there are a few people who do unfortunately experience post-finasteride syndrome that persists long-term, even after discontinuing its use. And these side effects, unfortunately, can be very real. This is true for those who are on the threshold of low androgen status to begin with. And, blocking DHT and spiking estrogen levels with finasteride can cause your androgen index to drop too low. And when this happens, it can lead to things like low libido, sexual dysfunction, in addition to a bunch of other low androgen symptoms. And thus, the importance of baseline blood work is key before taking any 5-AR inhibitors, because you can most likely reverse it simply by referring back to your baseline levels and either increasing your androgen index or modulating your estrogen levels. But with that said, most people who do experience side effects are able to stop finasteride and they will recover with no issues with endogenous levels of DHT returning back to baseline levels in a short period of time once finasteride has cleared and flushed from the system and their body starts 5-AR, converting testosterone into DHT again. Now, when someone is afflicted with androgen alopecia, it's highly recommended that they be on at least a 5-AR inhibitor like finasteride or dutasteride, basically to stabilize hair loss. DHT, as you guys know, is one of the main causes of genetic hair loss, and one of the most effective and FDA-approved ways to address DHT is with a 5-AR inhibitor. And luckily for those who do not want to opt to take oral finasteride, this recent study shows that topical application of finasteride has shown to have very similar efficacy to that of oral finasteride while minimizing systemic exposure by acting specifically on the hair follicles. This means that, near similar levels of DHT inhibition while lowering your potential for side effects is seen while applying topical finasteride as opposed to taking it orally. So let's go ahead and take a look at this study and see what we can find. All right, so here's a study, and scroll down here. We have okay, so methods. This randomized, double-blind, double-dummy, parallel group 24-week study was conducted in adult male outpatients with androgenic alopecia at 45 sites in Europe. Efficacy and safety were evaluated. Finasteride, testosterone, and DHT concentrations were measured. Of 458 randomized patients, 332 completed the study and 446 were evaluated for safety. Change from baseline and target area hair count at week 24, the primary efficacy endpoint was significantly greater with topical finasteride than placebo. Adjusted mean change 20.2 versus 6.7 hairs, and numerically similar between topical and oral finasteride. Statistically significant differences favoring topical finasteride over placebo were observed for change from baseline in total area hair count at week 12, and investigator assessed change from baseline in patient hair growth loss at week 24. Incidence and type of adverse events and cause of discontinuation did not differ meaningfully between topical finasteride and placebo. No serious adverse events were treatment-related, as maximum plasma finasteride concentrations were greater than 100 times lower, and reduction from baseline in mean serum DHT concentration was lower, 34.5 versus 55.6%, with topical versus oral finasteride. There is less likelihood of systemic adverse reactions of a sexual nature related to a decrease in DHT with topical finasteride. So let's go ahead and see here. Okay, so the experimental drug was topical finasteride, 0.025% concentration of 2.275 milligrams per milliliter, delivered using a spray applicator with a plastic cone that prevents product dispersion in the air. So that's what it looks like. It looks, that's the first time that I've seen something like this. Each actuation delivers 50 microliters of solution, equivalent to 0.114 milligram of finasteride. Topical placebo comparator contained the same excipients as the experimental solution: ethanol, PG, hydroxypropyl chitosan, and purified water, and was identical in appearance to and indistinguishable from active treatment. Oral finasteride 1 milligram was the reference drug for systemic exposure and was provided as film-coated tablets from Propecia Merck, over-encapsulated to maintain study blinding. The material, the matching oral placebo was an inert powder-filled capsule indistinguishable from the oral reference drug. So this cone-looking thing is the first time that I've actually seen someone use as an applicator for a topical. And to be honest, it doesn't really look to be that effective, especially if someone were to have thicker hair or just longer hair. This can definitely prevent, the topical from getting to the scalp, and it would just be wasted, just kind of lingering on the hair. I think a better applicator would likely be a dropper, especially like when you guys apply minoxidil using a dropper. And I feel like this would be a better way to actually get the topical directly on the scalp. The only issue is that 50 microliters of the spray would be equivalent to 0.05 milliliters. So imagine if you guys were using the 1 milliliter dropper that usually comes with liquid minoxidil. You would have to reduce that to 1/20th of the amount that you're actually using. So it would be incredibly difficult to, I guess, calculate the same amount, and chances are that you guys are going to be applying way more than the 50 microliters, which can lead to more systemic side effects and absorption. And that would basically make this study useless. But I think it would be interesting to see how different the results would be from using the spray applicator as opposed to an actual dropper. But even with this spray applicator, apparently it's been working pretty well and effectively, if they're claiming that it's comparable to that of oral finasteride. Using a computer-generated list, eligible patients were randomly allocated in a 2:1 ratio to one of three treatment arms: topical finasteride and oral placebo. Also, just I guess topical finasteride, topical placebo and oral placebo, or topical placebo and oral finasteride. All patients applied topical spray each morning to a dry scalp at the dose recommended by the study doctor. So 1 to 4 sprays or 50 to 200 microliters of solution depending on the extent of hair loss. The first spray was applied over a target 1 centimeter squared circular area in the scalp vertex, marked by a small dot tattoo to identify it for repeated efficacy assessments. Additional sprays, 2 to 4 if recommended by the study doctor, were applied to cover the rest of the baldness area. The topical spray solution was to be left in place for at least 6 to 8 hours and then washed off with shampoo. Now, so baseline assessments were performed at screening. Week 2, patients were randomized on day 1 and treated for 24 weeks. Assessments and study procedures were performed at weeks 4, 8, 12, and 24. Follow-up visit took place at week 28. In the event of early termination, patients were followed up at the early termination visit. Patients maintained a diary of daily compliance. Bottles and blister packs of study medications were returned assessed by investigators for compliance. So patient demographics and baseline characteristics, demographic details and baseline, blah, blah, blah. So we have a chart here, table 1, demographics and baseline characteristics. So it just kind of shows you the people that were involved. So topical finasteride, mean age was about 32 and a half. Same thing with placebo, 31.8. Oral finasteride was 32.3. Weight, blah, 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 Caucasian. And then their male pattern baldness. So they already specified that only type 3 vertex, type 4, and type 5 were considered. And this is at a 2:1 ratio. So we don't see anybody, suffering from a Norwood 2 or Norwood 5 plus, Norwood 6 or Norwood 7. It just kind of focused more in between 3 and 5. And I guess typically that's kind of like what we see in the majority of people who are losing hair. All right, so efficacy analyses at week 24, the adjusted mean change from baseline in total area hair count was significantly greater with topical finasteride than with placebo, and was numerically similar to that with oral finasteride. So if we look at this chart here, we have baseline, we have week 12 and week 24, and then this green one here is the placebo, and up here we have oral finasteride in purple, and then this darker navy color is the topical finasteride. And if you guys take a look, even at week 12, right, we have obviously oral finasteride, which is at 22.5 hairs at week 12 versus topical finasteride, which is just a tad under at 20.4, and then we have placebo at 7.6. And then as we move towards week 24, we have 20.2 for the topical finasteride, and then for oral finasteride, we have 21.1. And then scrolling down, here we have an image of baseline and week 24 macro photograph of a patient treated with finasteride 0.25% topical solution who was rated as showing marked improvement. There's clearly a significant difference from baseline here and week 24 in the number of hairs surrounding that black mole. Over here, we can see kind of like void areas where there's no hair. And over here, after topical application, we can see definitely improvement in hair density. And even parts like in this area here, we can see that there are more hairs that are emerging out, and also this bottom portion here. And then let's go down here. We have so table 3 shows the percentage of responders for secondary endpoints at week 24, post hoc sensitivity analysis. And if you take a look here, the investigator assessment is at 42% of responders, which is obviously higher than placebo and even for oral finasteride. Blinded assessor assessment is at 26 for topical, and it's pretty negligible with oral finasteride at 28.6. And then down here we have the individual patient assessment. So 29.3% were claiming that they had a smaller bald spot. And if you look at oral finasteride, it's once again pretty negligible. Hair appearance, 40.9 versus 36.9%. Hair growth, once again, is higher in topical finasteride than oral finasteride. Slow down hair loss, 41.4, higher again with topical finasteride. Satisfaction, front hairline. So I guess they did see results from using that on the front hairline as well, because 21.6% responded with positive results versus 17.9 for oral finasteride. Satisfaction on the top of the head, 26 versus 23. And then overall change, 26.5 versus 25 for oral finasteride. So overall, it looks like the benefits from topical finasteride has been outweighing that of oral finasteride, which is pretty, it is pretty amazing to say at the very least. Now, moving down here, we have safety assessment. The percentage of patients with TEAE, which is treatment emergent adverse events, in the topical finasteride group was similar to that in the placebo group and lower than that in the oral finasteride group. Most, which is 96.9%, were mild or moderate in intensity. 10 patients reported treatment emergent serious AEs, of which none were considered by investigators to be related to study medication. So, just looking at this chart, we have patients with treatment emergent adverse events. It's at 41.4% versus placebo, which is also at 42, and then 48.8. So if you consider the percentage between topical finasteride and placebo, they're pretty similar, and once again we see that oral is higher. And basically, treatment emergent adverse events are adverse events that happen only once treatment has started. This is not related to drug-related adverse or drug-related treatment emergent adverse events. And if you take a look at the chart, once again, the percentages were pretty similar across the board, with topical finasteride being lower than that of placebo. Mild reactions were at 32.6 versus 33 and then 39, so oral finasteride was still higher. Moderate, 70.7 versus 22.6, and severe was at 2.2% versus 2.4, so topical finasteride was still lower. And patients with treatment or patients with treatment-related Treatment emergent adverse events was at 9.9 versus 6.6 for placebo, and then 11.9 for oral finasteride. And then scrolling down here, we have patients with treatment emergent serious adverse events, which is at 2.2, and then 2.8 for placebo, and then 1.2 for oral finasteride. And then patients with treatment-related serious adverse events, they're all 0 across the board. So, this further validates the safety profile of both oral and topical finasteride. And when we actually break down the treatment emergent serious adverse events for, topical finasteride, it was mainly due to topical application, which caused pruritus or irritation of the skin, as you guys can see here. Erythema, 2.2% for topical versus 0 for oral, obviously because you're not applying anything. And loss of or reduction in libido, 0.6% for topical, and then 4.8% for oral finasteride. There was no clinically meaningful changes from baseline or differences amongst the treatment groups in mean values of hematology, serum chemistry, and urinalysis results. And then there were no significant differences between topical finasteride and placebo in mean scores for any item on the sexual dysfunction questionnaire. At week 12 or 24, mean scores were all items were similar between topical finasteride and oral finasteride at week 12 and 24. Treatment-related sexual adverse events, sexual dysfunction, erectile dysfunction, libido decrease, loss of libido, were reported in 2.8% versus 3.3% versus 4.8% of patients treated with topical finasteride, placebo, or oral finasteride. So topical was at 2.8, and then oral finasteride was at 4.8. So it was still a lot lower, almost half the amount lower in topical finasteride. Discontinuations due to treatment-related sexual adverse events were reported in 0% versus 1.1% versus 2.4% of patients, respectively. So after they stopped applying topical finasteride, none of the patients actually reported any side effects after discontinuation. Cessation of the treatment had completely reversed their side effects. And more importantly, let's take a look at serum DHT levels here over the past 24 weeks for topical and oral finasteride. We can see here that, let's see here. So at week 24, we have placebo, which is at 2.25% versus baseline for the serum DHT concentration. The orange graph that you guys see is at negative 34.52% versus baseline for topical finasteride. And then for the oral finasteride, we're looking at 55.6% lower than at baseline in the oral finasteride group. So all in all, this study did show that the efficacy of topical finasteride was numerically similar to that of oral finasteride in terms of hair count, while the maximum mean plasma finasteride concentrations were more than 100-fold lower with the topical versus oral formulation. And also the impact of serum DHT concentrations after 24 weeks treatment was statistically significantly lower with topical versus oral finasteride. While topical finasteride doesn't exclude, the possibility of systemic adverse events related to decreased DHT levels in both groups, this definitely will lower the possibility of systemic side effects, and it may be a good viable option for those who do not choose to take oral finasteride. I think for those who are truly afraid of potential side effects, trying the topical route is highly recommended. And even for my case, I've been taking oral finasteride, and I think this is something that I may consider as far as a topical is concerned, instead of just sticking with the oral route. Not that I'm experiencing any side effects, but it may be a good experiment to see how the hair holds up from topical use. And also because it does reduce potential systemic side effects, it may be a good option to switch over. I really haven't decided yet, but in the near future, I may just end up trying it just to see how it works. As far as purchasing, topical finasteride, I do know that there are a few places that you can order from. 4Hims has a topical finasteride and minoxidil solution, but they're very expensive. I think they charge like $150 for like a month's supply. And I know certain compounding pharmaceutical companies can formulate it. There are other websites that sell it without prescription, like Minoxidil Max. So it's really up to you to do your due diligence in researching for it. You can also make your own topical, finasteride by mixing the tablets and crushing it, and then combining it in some type of PG or ethanol or minoxidil solution. And I also have a video that I made a few years ago that you guys can check out. But yeah, that wraps up this video. Hope it's been educational. It's definitely worth a try if you guys want to hop on finasteride, but are wary of potential side effects from oral finasteride. It's something that I would highly recommend adding to your hair loss treatment regimen if you haven't done so already. And one of the best ways to stabilize hair loss is with finasteride. Anyway, let me know your thoughts on this, on topical finasteride, in the comments below, and I will talk to you guys in my next video. Take care.